Hospitals across America are reportedly stocking up for supplies for treating COVID-19 round 2. Most hoping to avoid another scramble for critical medications and ventilators should a surge arrive in the fall, like so many are saying it might. Perhaps no area more concerned than right here in the Northeast and New Jersey, a former hotspot of the U.S. coronavirus outbreak. Now, late yesterday, I had the opportunity to speak with Bob Garrett, CEO of HACKENSACK Meridian Health, New Jersey's largest hospital system with 17 hospitals and some 500 additional patient care locations around the state. And I began by asking him what the current status of his hospital network is and how full they are from peak until now.
I would describe our situation right now as stable. We peaked in terms of COVID cases in the middle of April. I think it was on April 13th. And at that time, we had about 3,000 patients in our hospitals across the network. From the beginning of the pandemic through today, we've seen over 10,000 COVID-19 patients. The good news is today, as we speak, we have 105 COVID patients throughout our network. So that's a decrease of about 97%. So there's been a significant decline. It's been steady. There have been a couple days where you go up, a couple days where you go down, but overall the news is very good and we're stable. We're seeing less patients on ventilators, less patients in ICU settings. In general, you know, we've learned a lot, but we're just happy that we're in a stable period because it gives us an opportunity to kind of regroup and think about the future.
What have we learned? And are we sharing that with hospitals and other parts of the country? We were on the front lines, you and your team, all the critical first responders, God bless them, by the way. March, April, New York, New Jersey blowing up. And now it's kind of gone around the country. We are seeing hospitalizations, as a percent of cases come down, which is great news. Why do you think that is? And what have we learned?
Yeah, so the short answer is that we've learned a lot, and I want to take the opportunity also, Brian, to give a shout out to our heroes on the front lines, our doctors, our nurses, respiratory therapists, others. They were incredibly heroic through this entire pandemic, and I've said it before. I'll say it to you right now. When the definitive books are written on this pandemic, they will truly go down as American heroes. Having said that, we've learned a lot. So if you're a COVID patient in July, in terms of how you're going to be treated, it's like night and day from April. So I'll give you a couple of examples. We've learned how to keep patients off of ventilators, out of the ICUs. There's a technique called proning, where patients are actually turned from their back to their stomachs to increase lung capacity, and that has been an effective treatment in terms of keeping patients out of ICUs, out of ventilators. And so we actually have proning teams now that work on patients. That technique was not fully understood or in full operation back in March when the first COVID patients hit. On the therapeutic side, there's a lot more tools in our toolkit. You've heard about remdesivir as a drug of choice. That's certainly keeping patients, again, out of the ICU, off of ventilators, lower lengths of stay. Patients are just not staying on that drug regimen in hospitals as long as they were. And then the other really exciting news is convalescent plasma therapy. And we're doing a major study. We've infused about 800 patients already in that study, where we're taking patients that have antibodies or concentrations of antibodies, and we're infusing their plasma into sick patients. And it's really showing to be very, very effective from a therapeutic perspective.
Let me jump in here, Bob. I'm sorry to jump in on you just from a time perspective. That's amazing. Just flipping people over has made a huge difference. Truly amazing. I'll wrap it up with a two-parter. The idea of, bend the curve is so we can build up our hospital capacity and make sure that was the idea a couple of months ago. Have we, at least in New Jersey, quote, bent the curve? And what are you doing for the fall? Do you expect this second wave that everybody has so notoriously been talking about?
I believe we've absolutely bent the curve through social distancing, through the quarantines that did did happen in New Jersey during the peak. The masking, those are all techniques that have helped bend the curve. And I want to give the public, and the citizens of New Jersey a lot of credit for that, and our governor as well for really getting behind all of those great initiatives. So we've absolutely bent the curve, but we are expecting what we call COVID 2.0, another surge to happen in the fall. And we've actually documented all of our best practices in a playbook. And that playbook already has 27 chapters. So we've written it down. We know, as an example, what to do on supplies and what to expect in the fall, staffing, increasing capacity, increasing testing capabilities. And testing's been another great tool at our disposal. When this pandemic started, testing was very limited. And today, testing has expanded. As a matter of fact, New Jersey is testing per capita more than any other state in the nation. So this playbook, I think, is going to be a huge factor. And to get to your previous question, yes, we're sharing that playbook with others around the country, particularly those that are in the hotspots now, so they can learn from our experiences.